Have you noticed that since having your baby, your previous clothes, your bras, your tops all feel tight around your rib cage? Well, that is because an adaptation that your body makes during pregnancy to expand and make space for baby. Before we get into the exercises, I want to go over what happens in pregnancy to our ribs. And there's three main things that happen. One is as baby grows bigger, it displaces our abdominal organs and our respiratory diaphragm and lungs up and out. And so to accommodate that, our ribs, which are like bucket handles, so picture my arms, they have to expand up and out. Okay, so that's the first thing that happens. The second thing that happens is as baby grows, it shifts our center of gravity forward. And really what that means is that our spine shifts forward of our knees. And it's just how our body accommodates the forces of gravity through movement, through posturing, all of those things. But really what we want to be focusing on is because of this shift forward, okay, and you can practice that just by bringing the weight into the front of your toes, and you can feel how everything is getting pulled forward. What happens is that it lifts us up like this. Okay, so our ribs, because of this shift forward and because of baby growing, it lifts our ribs in the front and it drops our ribs in the back. Okay, that is why we have usually this much larger curvature in our low back during pregnancy. The third thing is because of these shifts, because of our ribs expanding up and out, because of our ribs shifting up in the front and down in the back, it then alters the muscles that are attached to the ribs as well as attached to the pelvis. So the major muscles that are impacted by this are our abdominal muscles, which lengthen out. Now, this is necessary, of course, because baby needs space, but it also shortens our low back muscles, it tightens our chest muscles, and it weakens our mid-back muscles, okay? So these three things all really need to be addressed for you to notice any changes in your ribs in postpartum. The goals of the exercises is to physically assist the ribs out of the expanded position, as well as to stretch the tight muscles and to shorten the lengthened muscles. So let's get to it. All right, let's get started. There are a few things that you're going to want to have is either squishy balls, exercise balls like this, or rolled towels. You're going to want to have either a yoga belt or a towel or a scarf. If you want to have a band, you can use a band. It doesn't have to be a tube band. It can be a flat band. And then either pillows or thicker blankets that you can fold up. Okay, so you can do all of these things without any of that. These are just going to be extra props that can help us along. So as I said before, our goal is to lengthen tight muscles and shorten lengthened muscles. So we're going to start off on our side. You can grab that rolled towel and put it underneath your waist. You can use a pillow for your head, or you can use your arm. And then you're just going to bend your knees and your hips. You are going to place your hands onto your ribs. From there, you are going to inhale into your back. You really want to try to expand your back ribs as much as possible. And then as you exhale, you're going to exhale all of the breath out. So you're going to inhale, and then you're going to exhale. And as you exhale and you're breathing all of your air out, you are going to also press down onto your ribs. So you're going to inhale and then exhale. And then you're going to hold that press with your next inhale and then do that 5 times. Okay. And as you keep going, with your inhales, you should be feeling that the breath is going more into your tight back ribs. And because you're holding your side ribs down, your side ribs and your front ribs are the ones that are typically the most expanded from pregnancy. And your back ribs are the ones that are really crunched up and restricted more. So we're really trying to get those back ribs to expand and the side and the front ribs to stay down a little bit more. Okay, once you've done 5 on this side, we're going to switch sides. And do it on this side. Okay, fantastic. So then you want to grab one of your pillows or your blankets and you're going to lay it on your lap. Okay, this is a little big, so don't get something this big. But you're then going to lay over it into a child's pose position. And hopefully you feel a nice, comfortable stretch in your back. And then you're going to pause here. You can rest your head down. You don't need to be holding your head up like I am. You're going to rest and you're going to breathe into your back. So you're going to inhale and exhale 5 times. Really letting it all out on your exhale. Because sometimes what can happen is we also kind of get stuck on an inhale because our ribs are stuck out. And so we don't actually get a full exhale, which means we don't actually get a full inhale. So let it all out, bringing yourself empty. Okay, once you've done 5 of these, we're going to sit up. Now this is where the yoga belt or a scarf or a thin towel come in. You can also just use your hands for this, but I find using something that you can hold on to is just more comfortable for your hands, especially if you've been dealing with wrist issues with holding your baby. So I'm going to turn so you can see where it is in my back. So it's on my lowest part of my ribs, and then I cross it in the front and hold it with my hands. Now what I'm going to do is I'm going to slouch so that I am shortening the front of my body and I'm lengthening the back of my body, but I'm not tucking my butt under. Okay, I'm still sitting up on my sit bones or the very bottom of my pelvis. I'm just rounding through my back. Then what I'm going to do is I'm going to breathe again, right? Our ribs are the moving bones for our breathing. So a lot of these have to do with our breathing. But when I exhale, I'm really focusing on using my little muscles between my ribs to pull my ribs down. Okay, I'm not going to be tightening up my belly. That's going to come. But for this one, I want you to keep your belly nice and soft. Okay, nice and soft. So I'm going to inhale. When I inhale, it's going to pull the band. Okay, and then I exhale and I'm going to pull and tighten as I wring myself out. And then I'm going to inhale. Five total times. Okay. Then from there, you're going to sit up against a wall. If you don't have a wall that you can sit against, you can do this laying on the floor. Or if it's really challenging for you to do it up against the wall, then I would suggest you do it on the floor in bed. So we're gonna place one arm up to the side like this, okay? Eventually, you want to get to doing two, but let's start with one. So you can also place the opposite hand onto the front ribs. This helps you determine if you are lifting your ribs away from the wall, up like this, right? That ringing of the bell forward, or if you are able to stay down without overly clenching your abs. Then you're gonna inhale. Again, you're gonna inhale into your back ribs. You're gonna anchor those back ribs with your inhale into the wall. And then as you exhale, you're gonna maintain that position as you slide your arm up. You might not get very far. I have restricted shoulders, so I don't have much range. So don't necessarily base it on what you're seeing my body capable of doing. Base it on your body. So you're gonna inhale, anchoring the back ribs into the wall, exhaling, sliding up. This really opens the front of the chest, and it also helps you get some strength in your mid-back. So a total of 5. And then we switch sides. Okay. If you feel extremely tight in your chest muscles, which you might, especially if you're breastfeeding, I would recommend that you do other chest stretch exercises, okay? It could be holding your arms behind you and breathing. It could be laying on a foam roller with your arms out. It could be doing angel wings, laying on your back and bringing your arms up. It could be a doorway stretch. All of those are great chest exercises to help open up in through here if you need extra. Okay, so from here, we're going to get onto hands and knees. This is where your band comes in, but you don't have to do it with the band, but I'm going to show you it with the band. So once you feel comfortable without the band, you can progress to this as well. So you would put it on the lowest portion of your ribs, and then you're gonna hold it down tight. It's gonna wanna pull you down like this. We're not gonna let that happen. We are going to round up into a cat pose, okay? So this is what it would look like if you progress to the band, okay? Now, without the band, you're going to round up into cat pose. In this position, again, you're stretching and lengthening the low back, the low ribs, and you are shortening and narrowing the abdominal muscles. But I want you to do this without clenching your abdominal muscles. Okay, if you feel like you're really having to clench your abs to get you into this position, then you may need to drop out of it a little bit. Then you can put something between your knees to squeeze. If you don't have something, you don't need something, but you're still going to be doing the same motion. So I am rounding up, not tucking my butt, just rounding my spine. I'm going to inhale again through my back. So I'm expanding my back, and then as I exhale, I'm pulling my legs together. I am closing the holes of my pelvic floor. I am pulling the holes up and in, and then as I do that, I am then zipping up from my pubic bone to my ribs, okay? Really very much midline. If you feel it more out to the sides, starting that zip up, then that means it's more your oblique muscles that are doing it. And I want you to pause, and I want you to start over. okay? Until you start to feel it happening in the transverse abdominis, which is going to feel much more midline and is going to create much more flattening of the belly muscles. And it all starts with the pelvic floor, okay? So you're going to inhale into your back, pull your legs together, close, lift, and zip. Inhale, softening, expanding into your back, pull together, close, lift, and zip. And as you notice, I'm doing this and I am not changing the position of my ribs. I want to make sure that I am up in this position the entire time. If you start to notice that when you inhale, you start to drop down, then just readjust, okay? So again, 5 of these. Okay, then you're going to take your pillow again and you're going to lay up against it so that you are kind of hovering. So it's more like this, okay? So there's going to be a gap, hopefully, between. So it's going to have to be a bigger pillow or multiple pillows stacked. If you have an exercise ball that is larger than this one, you could also put this behind your back to hold you up. You can also put one between your knees. So now there are 2 hand positions that you can use for this. One is behind your head so that you're supporting your head and your neck. This I would suggest you do, especially if you feel like you are clenching in the front of your neck muscles, right? You're really gripping in through here. Then I would highly recommend you hold your head or lower yourself down a little bit, okay? The purpose of this, again, is to lengthen the back and shorten the front. Okay, so then from here, what you're going to do is you're going to inhale, and then you're going to pull your legs together, close, lift, and zip. Okay, the other arm is here. Okay, so it's holding here, inhaling, exhaling, pull, close, lift, zip. Really making sure that you're getting this nice flattening in through the abs. Another thing to watch out for is bulging in the abs. So if you notice that the lower belly bulges out, or you get this kind of bread loaf bulging, or if you notice that you're getting a very central doming, then you want to make sure that you lower yourself down and you really focus in on the transverse abdominis, not your obliques, okay? And only do as much as you can actually control. Okay, so again, inhaling, exhaling, pull, close, zip. Don't clench up in through here. Fantastic. So these are just beginner exercises that you can use to start to get your ribs into more of a pre-pregnancy position. It's not only important for how you feel in your clothes, but it is crucial for your whole core system functioning. Because if our ribs maintain an up and out and a flared position, what happens is it keeps our whole pressure system unbalanced. So it's going to be harder to manage all of those pressures inside of our trunk with coughing, sneezing, lifting, right? And so it may be harder for you to heal a diastasis if you have one. It also keeps our abdominal muscles lengthened out and our back muscles shortened. So it's going to potentially contribute to back pain, SI joint pain, okay, because it's all compressed back here. And then again, it's going to be harder for you to activate your abdominal muscles. And you might feel like, oh, why do I keep having this mom pooch? And then it's also going to make it harder on your pelvic floor to work with everything else because it's unbalanced with how all of these muscles are working together. And they're going to potentially be more pressure down into the pelvic floor, and it may tighten up to try to help balance things out. So it's really important to help your body heal with your rib alignment in postpartum. And these are just exercises to start that process. Once you've done these, there are much more that you can do. And I hope that you really find some benefit from these. If you want more, let me know in the comments and I will make a progression of these types of exercises. And don't forget to like and subscribe so more people can see these videos and benefit from them, as well as you will be notified when more videos are uploaded. I really appreciate you being here and see you next time.